Okay, so my name is Alexa, and I will be your nurse today. I'm going to check 2 identifiers. So what is your name and date of birth?
Kinsley Woolbright, and date of birth is 10/21/04.
Okay, so I've checked with her armband, and that is correct. So now I am going to ask you where you are,
I am at nursing school.
who you are,
I'm Kinsley Woolbright,
and what year it is.
2025.
Okay, so my patient is awake, alert, and oriented ×3. Her communication is clear, her speech is clear, and it is appropriate for her age group, and her verbal communication is great for her age group. So now I'm going to inform my patient that she has the right to confidentiality and to refuse at any point of this assessment.
Perfect, thank you.
Yes. Okay, so now I'm just going to start on with your assessment.
Perfect.
I'm going to begin with your eyes. So I'm first just going to measure your pupils. So pupils are measured 4 millimeters, equal bilaterally. And now I'm going to dim the lights, and I'm going to test for dilation constriction. So I'm just going to shine this light in your eye, and it'll be really quick.
Perfect.
Okay, so pupils constrict equal bilaterally, and sclera is white. Pupils are equal, round, reactive to light, and now I'm going to test accommodation. So I'm going to hold my pen light right here, and I'm going to move it towards your nose.
Perfect.
So we'll just follow the pen light. Okay, so patient tested accommodation, and eyes constrict and go inward. So now I am going to tell my patient that we're going to go to the Snellen chart,
Okay.
and we are going to test your vision acuity.
Perfect.
So if you'll just stand up for me.
I'll probably look a mess.
So you're gonna, yes, stand at this line.
Okay.
It's 20 feet away from the sun chart.
Okay.
So I'm gonna tell you to cover one eye first.
Okay.
You're gonna cover your right eye. So I'm gonna test your left eye vision acuity.
Okay.
So
Wait, you said for the right eye?
yes,
Okay.
cover your right eye. And then read the lowest line you can read.
Okay. DEFPOTEC.
Okay.
Why is this hard?
Can you read this one?
L E F O P no D P O T.
Okay. So vision acuity in left eye is 20/20. So now cover your other eye.
Okay. Okay. I'm gonna go L H P O B P O T.
Okay. Now read this one for me.
Yeah, that's not soccer. DEFPOTEC.
Okay, so vision acuity in right eye is 20/20, and then now read with both of your eyes.
Okay.
And you can start from here.
Okay. EDFCZP, FELOPZD, DEFPOTEC,
Okay, so you're good.
Wait, what?
Vision acuity is 20/20 in right and left eye, equal bilaterally, and it is also 20/20 in just your right eye and 20/20 in just your left eye.
Perfect.
So I have also observed your gait, and your gait is normal as we walk through the Snellen chart. So now we're going back into the exam room. Going to have privacy. Okay, so I have done your eyes, so now I'm going to move on to your ears.
Okay.
So I'm just going to inspect the external ear, and you have 3 piercings on the right ear, and then I'm going to inspect the left ear, and you also have 3 piercings on the left ear. There's no drainage indicated, there are no lesions, there are no bumps. Skin is appropriate for ethnicity. Your external ears are symmetrical, and they are aligned with the external outer canthus of your eye. Okay, so that's your ear, and now I'm going to go on to your nose.
Okay.
So I'm just looking at your nose, I'm inspecting it. There are no macules, no discoloration, no lumps, no freckles, no masses, and it is symmetrical with your face, and your septum is midline. So now I'm just going to ask you to tilt your head back, and I'm going to use my pen light and shine in your nostrils. Okay, so you have pink and moist nostrils, right and left turbinates present equal bilaterally.
Perfect.
And now I am going to move to your mouth and throat.
Okay.
So I will use my pen light again and just look in real quick. So you'll just open your mouth for me.
Okay.
Okay. So buccal mucosa is pink and moist and equal bilaterally. Your tongue is midline. There are no lesions, no bumps, no moles. Your teeth are white and clean. You have no cavities.
Yay.
I'm going to inspect your tonsils
Okay.
and your uvula. So if
Okay.
you'll just say ah when you open your mouth.
Okay.
Go ahead.
Ah.
Okay, so uvula rises on phonation,
Okay.
and tonsils are graded a 2+.
Yay.
And gums are pink and moist.
Okay.
And so your mouth looks great.
Yay.
Now I'm gonna test for gag reflex unless you
Okay.
want to defer.
I would like to defer.
Okay, so I'm just going to explain how I would do this. I would get a tongue depressor and I would put it on your mouth, on your tongue,
Okay.
and then it would initiate a gag reflex.
Perfect.
And that would be normal.
Okay.
So I am done with your mouth and your throat. So now I'm going to move on to your neck.
Okay.
And I'm going to inspect the neck, and the
Okay.
neck is appropriate, skin color is appropriate for ethnicity. There are no lumps, there are no lesions, there are no moles, there are no macules. And now I'm going to assess with my pen light for pulsations.
Okay.
So there are no pulsations present on the right or left carotid, equal bilaterally.
Okay.
And so now I'm going to feel for a thrill.
Okay.
So no thrills felt with palpation on right or left carotid. And so now I'm going to grade your pulse.
Okay.
So if you'll just hold your breath for me. Okay, okay. And then deep breath for me. Okay, I grade 2+ equal bilaterally, right and left carotids. No thrills, so now I'm going to auscultate and listen for any bruise.
Perfect.
With the bell. Okay, so there are no bruise present on right and left carotid, equal bilaterally. And your pulse is graded 2+ equal bilaterally, regular rhythm. Nothing to worry about there. So now I'm looking at your trachea. Your trachea is midline, your neck is midline, and now I'm just gonna go ahead and move on to your posterior chest.
Okay.
So I'm gonna reveal you a little bit.
Okay.
Your gown will be open in the back.
That's all right.
And first thing I'm going to do is just inspect your chest.
Do you want me to sit right here?
Yeah, you're perfect right there. So I'm inspecting the posterior chest, and skin is appropriate for ethnicity. There are no melanoma, no moles, no macules, no rashes. There's no bruising. There are no lacerations. There are no birthmarks. Skin is appropriate for ethnicity. And now I'm going to palpate for tenderness. So if you feel any tenderness at all, just stop me and let me know.
Okay, yes ma'am.
Okay, no tenderness felt with palpation on the posterior chest. So now I'm going to listen for lung sounds in your breath.
Okay.
So I'm going to auscultate. So if you'll just take deep breaths for me.
Okay.
Okay, so breath sounds are clear and equal bilaterally on the posterior chest. And now I'm going to palpate for CBA tenderness.
Okay.
So if you feel any tenderness, just let me know.
Okay.
Okay, so there's no tenderness felt with palpation on the CBA. And now I'm going to just assess for thoracic expansion, and if you'll just do a deep breath in and out. Okay, so thoracic expansion is symmetrical and even. And so I'm done assessing your posterior chest, and now I'm going to move to the front of you and assess your anterior chest.
Okay.
So I'm going to reveal you. I'm
Okay.
going to have to go under your gown, and I just want to let you know.
That's all right.
So first thing I'm going to do with anterior chest is I'm going to inspect it.
Okay.
So. Okay, so your anterior chest has skin is appropriate for ethnicity. There are no discolorations, no bruising, no rashes, no moles, no freckles, no macules, no irritations, nothing abnormal. Okay, so now I am going to palpate for tenderness. So if you feel any tenderness at all, let me know.
Okay.
Okay, no tenderness felt with palpation on the anterior chest. So now I'm going to listen and also take for breath sounds. Okay. Deep breath in and out.
Is that on the way? I'm sorry.
Okay, so breath sounds are clear and equal bilaterally on the anterior chest.
Okay.
So while I'm on the chest, I'm going to go ahead and listen for heart sounds.
Okay.
So I'm going to start with the aortic valve, and I'm going to listen with my diaphragm first.
Okay.
S1 and S2 present, no murmurs, regular rhythm. So now I'm going to my pulmonic valve. S1 and S2 present, no murmurs, regular rate and rhythm. So now on the pulmonic valve. So now I'm going to the tricuspid valve. S1 and S2 present, no murmurs, regular rate and regular rhythm on the tricuspid. So now I'm going to the mitral valve. S1 and S2 present, no murmurs, regular rate, regular rhythm on the mitral valve. So now I'm going to listen with the bell on my stethoscope.
Okay.
So I'm going to start with the mitral.
Okay.
S1 and S2 present, no murmurs on the mitral valve. S1 and S2 present, no murmurs, regular rate, regular rhythm on the tricuspid valve. S1 and S2 present, no murmurs, regular rate, regular rhythm on the pulmonic valve. S1 and S2 present, no murmurs, regular rate, regular rhythm on the aortic valve. So I've auscultated with my diaphragm and with my bell. And so now I'm going to feel for your apical pulse, and it will be a little uncomfortable, but bear with me. So I'm going to feel for it, and then I'm going to listen as well. So when I feel for it, I'm going to assess your respiratory rate, and I'm also going to be counting for your heart rate. So this might take a couple minutes.
That's okay. Yeah.
Okay, so respiratory rate is 16. So now I'm going to also take for the apical pulse. Okay, so heart rate is 73 beats per minute, regular rhythm. Your pulse when I was palpating was a 2+. So normal regular rhythm and rate. And so now I'm going to assess your upper extremities.
Okay.
So you go ahead and put your gown back on.
Thank you so much.
Yes, thank you for letting me assess you. Okay, so you're all covered up. So now I'm going to first inspect the skin on your arms, and your skin color is appropriate for ethnicity. There are no bruises, there are no lesions, there are no moles, there's no swelling. Okay, so now I'm going to assess your hands.
Okay.
Your hands, skin is appropriate for ethnicity. There are no lesions, bruising, swelling, moles, bumps. So now I'm going to just go ahead and test your capillary refill.
Okay.
So I'm going to touch on all 10 of your fingers.
Okay.
Okay, so capillary refill on all 10 fingers is less than 2 seconds, equal bilaterally. So now I'm going to test the strength in your hands.
Okay.
So if you'll just grip my hands for me.
Okay.
Okay, patient strength is 5+ in hands, and then I'm also going to get you to put your hands against mine. I'm going to resist, and you're going to resist back.
Okay.
Okay, so patient is graded a 5+ in muscle strength in hands, and then I am going to get you to hold your hands like this.
Okay.
I'm going to test your arm strength and your elbow strength. So I'm going to pull against you, and you're going to pull back. Okay, so now I'm going to push, and you're going to push back. There you go. Okay, so there's 5+ muscle strength in elbows and arms, and so now I'm going to push on your shoulders, and you're going to shrug your shoulders against my resistance. Okay, so 5+ muscle strength graded in the shoulders. So now I'm going to test your range of motion in your hands. So if you'll just go like this and extend, abduct, there you go. Okay, so there's full range of motion in the hands. And now your elbows, I'm going to hold your elbow, and you're going to flex and extend. Full range of motion. Full range of motion, and equal bilaterally in elbows. So now I'm going to ask you to Just raise your hands like that.
Okay.
There you go. Full range of motion in arms, equal bilaterally. And then if you'll do your shoulders, you will abduct and adduct.
Okay.
Okay, so full range of motion in shoulders. Okay, so now I'm going to assess your pulses.
Okay.
So I'm going to do your radial pulse first. So I'm just going to feel right here, and I'm going to do this the same time. Okay, so radial pulses are graded 2+ and they're equal bilaterally.
Okay.
So now I'm going to do your brachial pulses. And your brachial pulses are 2+ equal bilaterally. I think I'm good with your upper extremities. So now I'm going to ask you to lay down on the bed,
Okay.
and I'm going to assess your abdomen. So I will also be revealing you a little bit, if that is okay.
Sorry, Miss Tina.
Okay, so would you like to use this sheet to cover up?
No.
Okay, so I'm going to reveal your abdomen. I'm going to inspect the abdomen, and skin is appropriate for ethnicity. There are no bruising, there's no freckles, there's no moles, no lesions, no bumps, and the umbilicus is midline, and you have no piercing on the umbilicus, and it is symmetrical. So abdomen inspection looks great. And so now I'm going to listen for your bowel movements.
Okay.
So I'm going to start in the right lower quadrant, and I'm going to go to the right upper quadrant, left upper quadrant, and left lower quadrant.
Okay.
Okay, so there are normoactive bowel sounds times 4 all quadrants equal bilaterally. So after I have listened to your bowel sounds, I'm going to do light palpation.
Okay.
So if you feel any tenderness at all, let me know, and I'm going to begin with the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant.
Okay.
No tenderness felt with palpation for light palpations. So now I'm going to do deep palpations.
Okay.
Okay, so no tenderness felt with palpations for deep palpations in the abdomen. So no tenderness reported, equal bilaterally, and now I'm done with the abdomen, and I am going to ask my patient if they would like me to assess the femoral pulse.
I would like to defer.
Okay, so my patient defers, so if I were to assess the femoral pulse, I would use my 2 fingers. At the same time, I would find the groin area, and I would palpate, and I would grade the pulses there. So now I'm going to go ahead and assess my patient's lower extremities.
Okay.
So you can put down your gown a little bit so you're not as revealed. And first thing I'm going to do is inspect the lower extremities, and skin is appropriate for ethnicity. There are no lesions, bumps, moles, freckles, scarring, any abnormalities. So now I'm going to assess for edema. So I'm just going to push on your shin.
Okay.
Okay, so no edema present, right or left, lower extremities equal bilaterally, and I grade that a 0. And then I'm going to feel for temperature for the warmth. The back of my hand. Patient is warm, temperature is normal and warm. So now I am going to assess for varicose veins. There are no varicose veins present in my patient, bilaterally, right and left legs. So now I am going to inspect my patient's feet, and do you mind if I take off your
I do not.
socks?
I can do.
Okay.
I'm so sorry.
You're good.
I'm so sorry.
Okay, So, just going to inspect my patient's feet. Skin is perfect for ethnicity. There are no lumps, bruises, lacerations, open wounds, no swelling, no edema. Okay, so now I'm going to look at the soles of her feet, and her soles are normal, and there are no lacerations, no bruising. Skin is perfect for ethnicity. So now I'm going to assess for capillary refill in all 10 toes. Okay, so there's capillary refill less than 2 seconds in all 10 toes. And now I am going to assess for range of motion in your toes. So will you wiggle your toes for me? Okay, so there's range of motion, and then will you flex and extend your feet? Okay, so there's full range of motion in toes and feet. And then will you just rotate your ankles, and also full range of motion in ankles. So now I am going to push my hands against your feet and test for your feet straight. Okay, and I'll pull. All right, so feet straight is graded a 5+ equal bilaterally. And now I'm going to provide resistance against your legs. So you're gonna lift this leg, and I'm gonna push down.
Okay.
All right, you're done. And I grade that a 5+. Okay, so there's 5+ muscle strength in legs equal bilaterally. And then would you just bend your knee for me? Okay, so there's full range of motion in knees equal bilaterally. And then will you extend, abduct and adduct your hip?
Sorry.
So there's full range of motion in hips equal bilaterally. So now I'm going to feel for pulsations, and I'm going to feel for popliteal pulses at the same time. I grade them 2+ equal bilaterally, popliteal. So now I'm going to do the tibial pulses. 2+ equal bilaterally, and then I'm going to do the dorsalis pedis. Two plus equal bilaterally. So I have assessed pulses, I have assessed range of motion and strength, and now I'm going to ask my patient to stand up. Okay, and I've already observed her gait. Her gait is normal walking to the Snellen chart. So if you would just turn around for me, I'm going to ask you to bend over. So my patient, and touch your toes. My patient has, there you go. You can sit back up. Full range of motion in spine. And while she was bent over, I assessed her hips and her shoulders, and they were symmetrical bilaterally, and her spine is symmetrical as well. So her scoliosis screen is negative, and I think that I have fully assessed my patient from head to toe.
Woo! Great job.